Good afternoon, everyone. I think in the interest of time, we're going to go ahead and get started. I think we've got about 1:35. I know that they're working on cooling off the room a little bit and also working on getting a few more chairs. Thank you so much. So good afternoon, everyone, and welcome so much to our Title V Skills Building session this afternoon. It's wonderful to see all of you, so many familiar faces, as well as many new ones, too. My name is Kate Marcel, and I serve as a project officer in the Division of State and Community Health, lovingly referred to as DISH, within the Maternal and Child Health Bureau at HRSA. Many of you may not know me yet, so I thought I would say just a little bit about myself. I've been with HRSA since 2002. I started very, very young. And I joined the Maternal and Child Health Bureau and DISH in 2010. My primary role in DISH is as a project officer for the Title V Block Grant, working with the 6 states in Region 3. And I also serve, yes, go Region 3. I also serve as a project officer for our cooperative agreement to advance urban MCH leadership with City Match. Most recently, following the departure of our former colleague, Michael Spencer, who ditched us to join the lucky Maryland State Title V team, I've taken on the role of project officer for our cooperative agreement to advance state MCH leadership with AMCHP. I very much look forward to working with all of you in my new role with AMCHP and hope you guys have a fabulous time at the conference this week. I just know that you will. And let's see. This brings me to my next slide. Since cute baby pictures are a must in MCH presentations, here's your dose of cuteness for the afternoon. I'm a little bit biased. This is my 14-month-old daughter, Josie. She's DISH's newest honorary member. And yes, she's 14 months old. This picture was taken just last weekend before the start of the Super Bowl game. As a South Jersey native myself, I had to make sure she rocked her Eagles green bow. So go Eagles. And please don't let the calm and sweet face fool you. She's bucking all gender stereotypes and is more wild and active than both of her brothers combined. On a more serious note, though, Josie and her 2 big brothers are really my why. You know, they're the reason that I love the field of maternal child health and want to work in partnership with you guys to improve the health for all mothers, infants, children, and their families. Also, as a side note, please pray for my husband as he attempts to keep all 3 of them alive this weekend. My parents live just 2 blocks away, so he should have some intergenerational support there. Okay. Now, before I introduce Michelle, I wanted to take a few minutes to go over our agenda and also to let you know there should have been a folder of information on your chair. The slides are included, a packet of the slides, as well as some additional handouts that you might want to reference as we go through the afternoon. We've got 4 overarching sections that we'll be covering with lots of great information. We're going to start off giving you a bit more background information about DISH and then jump into an overview of the updates most recently made to our application and annual report guidance. Then we're going to take a deeper dive into the guidance and talk through the rationale for the revisions with a focus on 4 sections: the NPM framework, the National Survey for Children's Health, CSHCN and Family Partnership, and the narrative format, state action plan table, and reporting forms. After this, we'll plan for a brief break, and then EJ Tom will spend some time talking about the updates to the Title V Information System, or TVIS. We're going to wrap up the afternoon with a discussion of state data reporting forms and also have a final Q&A session. Okay, now without further ado, I'd like to introduce Michelle Lawler, who I'm sure most of you know. As the Director of the Division of State and Community Health, Ms. Lawler provides national leadership, direction, and administrative oversight for the State Title V Maternal and Child Health Block Grant Program. She also provides programmatic oversight for the State Systems Development Initiative Grant, or SSDI, and 3 cooperative agreements to advance state and urban MCH leadership. A nutritionist by training, Ms. Lawler served as the project officer on task orders with the Institute of Medicine that produced the 2009 Weight Gain During Pregnancy, Re-examining the Guidelines Report and Recommendations, as well as the 2013 Workshop Summary Report on Leveraging Action to Support Dissemination of the Pregnancy Weight Gain Guidelines. Prior to coming to MCHB in 1998, she held a nutritionist position in the Food and Nutrition Services of the U.S. Department of Agriculture. Her previous experience includes work in local public health programs, the private sector, and teaching at the university level. Also of note, my daughter Josie will be upstaged by an even newer honorary DISH member with the arrival of the littlest Lawler later this spring, who will add the very important title of Grandma to Michelle's bio.
Thank you, Kate. I have to chuckle. She said she came in 2002 at a very young age. Well, some of us date back a little further than that, so thank you, Kate. It's a pleasure. You know, you write these titles for these sessions like 6 months in advance. So today, several of the staff are looking to find our session, and we're like, it's not there, it's not there. And it's advancing MCH through something. We're like, what were we thinking? So anyway, it's wonderful to see a packed house, because I'm telling the people outside, if people are looking for the block grant session, tell them it's down here. So it's wonderful that all of you are here. The purpose, what we hope to do today, is kind of everything you need to know to get ready for the block grant application annual report. We have a lot to cover, so we're going to kind of go fast. This is not the only opportunity you have to learn what you need to know, but we do want to sort of give you a high-level overview, and then you're going to hear, particularly from our TVIS folks, that there are opportunities for learning labs, and we can do webinars or whatever you need if there are questions. I thought first I'd just start, though, with a little overview of the Division of State and Community Health. I know we have a lot of new Title V directors, and, we've been around a while. We call ourselves DISH, but for those of you who might be newer to the MCH world, you may not quite know what DISH is. Division of State and Community Health, our mission very much matches the mission of the Maternal and Child Health Bureau, and that's to work in partnership with the states, primarily through the Title V MCH block grant, to work with communities, grantees, to assure continued improvement in the health, safety, and well-being of the MCH population. Our functions, our staff serve as the project officers and the regional consultants. So we have both a project officer, usually in the central office, but not always, and then we have a regional consultant as well for each of the states that receive the block grant. Also, a process we have just finished, I am so happy to share. And we have a new guidance, which we're going to be talking about today, but that is a process that involves several rounds of Federal Register notices, seeking public comment, and we do this, we update our guidance in conjunction with you all, with our partners. So just in advance to thank you for all the comments you provided and the input you have provided over the past 12 months. And we submitted it to the Office of Management and Budget in December, and we submitted it earlier, but I'm pleased to say we got their approval in December, so we actually have a approved guidance that we can talk about today. Also track state progress in meeting national and state performance objectives, as well as the coordinated technical assistance opportunities. The Title V legislation includes that we need to respond to your technical assistance request. We have designated funds. Doesn't have to come out of your block grant. You do have to submit a request for them, and our project officers can work with you to do that. But certainly technical assistance is available. As Kate said, these are the grants that the division oversees, and that's, of course, our big one, and is the largest investment in the Maternal and Child Health Bureau is the state jurisdictional Title V MCH block grants, as well as SSDI. We have 3 cooperative agreements for state and urban Title V leadership, as well as the Public Health Coordinating Center for Autism. and then 3 contracts, one of which is the Title V information system. We also have the technical assistance contract and a new contract that was just awarded last year, and some of you heard about it earlier in the SSDI section, but a contract to develop a MCH survey for the 8 jurisdictions, and that work is in process. I am going to ask members of our staff to please stand. Here you see our pictures. And I did stretch the picture a little bit, and someone said, well, don't go sideways with it. So if we look a little wide, it's because I did that. But here are your project officers, your regional consultants, as well as folks sitting up here at the front. Please join me in thanking them for all that they do. They are a terrific group and very knowledgeable. I'd also like to call out a couple of MCHB colleagues in the audience and who really have been instrumental in the changes that we're talking about today. We had 3 work groups that were part of the development of the new guidance, and one was a performance measure group, which was chaired by Christopher Dickton, who you're going to hear from, but also Dr. Michael Kogan. I see you, Michael. Dr. Michael Kogan, please stand, who is the director of the Office of Epidemiology and Research, and our division works side by side with him. The second work group was the Children with Special Needs and the Family Partnership Work Group, and that was chaired by Ellen Volpe, who you're going to hear from today, but also our colleagues in the Division of Services for Children with Special Needs. And I'm going to ask Joan Scott, who is the acting director, and Dr. Marie Mann, to please stand, and Marie is the acting deputy director, and they have been such good partners. Thank you all. Now, moving on to the Title V MCH Services Block Grant. Consistent with the block grant concept, the updated application annual report guidance retains the right of each state and jurisdiction to determine your priority needs. You do a comprehensive needs assessment. From that, you identify priority needs, and everything, the state action plan, all of it flows from there. Once you identify your needs, develop tailored strategies to address them, and to assume accountability in achieving measurable progress towards your stated goals. As you know, the application annual report guidance includes, similar to last time, includes 2 documents. One are your instructions and your reporting forms. The other is an appendix of supporting documents. And I really want to emphasize to you, look at that appendix. There is some wonderful information in there that really helps to give background information to what is discussed in the instructions and the reporting forms. Good information, more detailed information on your performance measure framework, your family partnership continuum, as well as the glossary. And you're going to hear me say a couple of times today that we have updated the glossary. We've actually tried to enhance it. We got some really good comments from the field on areas where maybe we were a little inconsistent across sections of the guidance, as well as just trying, particularly with the performance measure framework, trying to give better definition and examples to, some of the ESMs, the evidence-based strategy measures. But the narrative and data reporting requirements, they are really based on the legislative requirements. So they're not something we just sit in rooms back at the Bureau and say, oh, what can we ask for? They really are based on the legislation. And while we address the legislation, we always try to give consideration to the burden that we are imposing on the states. In your packets, you have a handout. Sometimes I think it's easiest to talk about updates by sort of what's changed. So that's kind of the approach that we're going to take. What we really tried to do with the updates to the guidance to continue to emphasize program accountability, promotion of evidence-based or informed strategies, while at the same time recognizing the need for state flexibility. And you're going to hear that as we go through it today, greater flexibility for you to select measures, be it national measures or state measures, that really align with your priority needs. So as we kind of walk through this, I'm making sure I'm giving all the, I've got notes here on which handout I need to make sure you look at. Let's just kind of walk through it. So relative to the performance measure framework, and you're going to hear more about each of this. This is just going to be a real high-level overview. Then we're going to have our team go through and talk to you this year a little bit about the reasoning that went into some of the changes that we decided to make to help you all see, what led to this change. So you're going to hear more about this. This will just be a very high-level overview, and then we'll get into the practical application, the TVIS. But the performance measure framework has not changed. And in fact, Chris will go into more detail there, I think there was only one national measure that there might have been a couple of additions to. So the measures are pretty much the same. The framework's the same. Where the change is in the number of national performance measures that you're required to select. Last time you selected 8 of 15. This time you need to select a minimum. I didn't say maximum. Minimum of 5 national performance measures, and that's one national performance measure in each of your 5 population domains. And again, those domains have not changed. You were required to establish 3 to 5 state performance measures. This is kind of a big change. There is no maximum or minimum to the number of state measures you need to establish. Did I say you don't need to establish them? No. But you need to look at your priority needs. You have to pick at least 5 national performance measures, 1 in each domain. Now, you need to look at your priority needs. Every priority need needs to be addressed by either a national measure or state measure. So the degree to which maybe the national measures don't align well with your priority needs, you may need to establish 7 to 10 state performance measures. If they align beautifully, you may need to have no state performance measures and just have 7 to 10 national measures, or more than likely some combination of both. So what is driving this is, we heard from you all. And I do want to emphasize the changes you're hearing, a lot of it is what you have told us over the past 3 years. And we've heard from many of you that some of the national measures didn't align well, and sometimes you felt like the national measures were kind of driving things. Priority needs drive your state action plan. So again, it's the combination of national measures and state measures to ensure that each of your priority needs are being addressed. Now, each of the, again, nothing changed in priority needs. 7 to 10 priority needs, you identified those based on your 2015 needs assessment. Probably haven't had any changes. It begs a nice question here where we talk about, and we're going to get into the state action plan. We realize you did a 5-year state action plan. You've done 3 years of that. Do you have to change it? No. You can continue with your state action plan and make no changes, provided that every one of those priority needs are being addressed by a state or national measure. You can carry forward with what you've already got in place. But if you feel like you're not really addressing your priority needs and you want to make some changes, this is the year to do it. But it still builds on those priority needs that you established based on your 2015 needs assessment. good point to make here. It's a 3-year guidance. So we've been approved for 3 years. So it'll be an interim application this year, interim application, annual report next year. And then the final year of this guidance is the needs assessment. I know some of you are already starting on your needs assessment. You know what you need to do. The requirements are in there. So hopefully that will be helpful. I know it's always difficult. You're mid-cycle in a state action plan, but at the same time, you do have enough knowledge to know what the requirements are going to be for the needs assessment. So no changes on the 7 to 10 priority needs, the MCH domains, and there is a handout in your packet. One handout that the first one that's in there is really your checklist, talking about the 3 years and what you need to do each year. I think it's the third handout is a table, and a lot of check marks on that table. It crosswalks the national measures with the domains. As you remember last time, we had 6 domains. We had 5 population domains and a cross-cutting life course domain. There has been a change. We retained the 5 population domains, but we've added an optional 6th domain that is now cross-cutting systems building, not life course. That's not saying we don't believe in life course. We do. It's actually intended to strengthen that. But recognizing that's, the 3 measures we had within life course weren't really life course. They were more, they just applied to 2 populations. So as you can see from that chart, we have broken those down into the relevant population groups. And actually what it does is give you a little more selection in each of those domains. The 6th domain, recognizing that states have a lot of systems building needs, your infrastructure, your workforce, your data, that maybe don't apply directly to any one population. This is a domain where you can capture those needs and create a state measure or state outcome measure to address that. There are no national measures as of now in that domain. And you'll hear more from the TBIS folks. It's optional. If you don't have anything that fits there, that's fine. You don't try to fit something into it. Now, the state action plan, there is a continued focus on the implementation of evidence-based and informed strategies and measures. Again, I really want to highlight some of the additions to the appendix in both the performance measure framework, particularly the glossary. We have an enhanced definition of evidence-based that includes some state examples. So hopefully you'll find that helpful. The narrative discussion is now organized by the 5 MCH population domains. If you have a measure in the 6th domain, you've got a section to put that narrative in there. One of the areas we really tried to strengthen is family partnership in children with special health care needs. The Bureau has a very strong commitment in this area, but sometimes it just didn't come out as clearly in the guidance, so we really tried to strengthen some of the language, be clearer on the expectations, what we wanted you all to be talking about in your application annual report. One area you will notice is the title. And for those of you who reviewed and commented on the June guidance, it was Family Consumer Partnership. We heard from many states we don't like that title. There's a lot of sensitivity around that title. So working with our partners in the Division of Services with Children with Special Needs, we're calling it Family Partnership. We have a new definition. And also tried to outline clearer reporting expectations, specific program activities, impact. As you hear that word frequently, we need to demonstrate the impact of some of these efforts and the value relative to MCH outcomes. Recognizing, too, when we say family partnership, We're not just talking about children with special needs. We're talking about all of MCH. So the hope of trying to bring that into the narrative across all of those domains, and then particularly you still have a designated section for children with special health care needs. And in that section, really to try to be a little more specific in your components of your state system of care and the impacts that you've been able to achieve. Lastly, but certainly not least, is burden. And we recognize these application annual reports are quite a work of that. They require considerable effort. And we really, with the transformation 3 years ago, we tried very hard to reduce burden. And we did one area in which we were able to do this is the pre-population of national performance measure data. But with this one, we continue to look at areas where, are there things that we can further reduce burden, streamline, combine reporting requirements. So we've hoped we've been able to do that. It's not an end. It's for us, it's an ongoing process, and we'll continue to work at that. And you all let us know how we're doing on that. Refined instructions and some of our budget forms are, we really tried to go back in the instructions and see if we couldn't make those clearer for you. And the improved functionality, which you're going to hear about again, you were able to use it this year, but hopefully you found it helpful, the word upload capability in the TVIS. So with that, it is my pleasure to introduce Christopher Dickton, who many of you know Chris. For those of you who've been around, you know Chris when he used to work with SAIC and was on the other side with the Title V information system. Then we were able to convince him to come to the Bureau. And actually, he's been in our division, so many of you know him as the Western Branch Chief in the division. More recently, last year, I am very pleased to say, Chris was selected to be the Deputy Division Director, and he has certainly been my right-hand man over the course of this past year. As you also know, Chris is quite entrepreneurial. He gathered all the water bottles, and he's offering to sell them to us for $1 a bottle. So, I don't know about that, but anyway, Brad, I did share with him your joke, but anyway, it is certainly my pleasure to introduce Christopher Dickton, who's going to facilitate the next section. Thank you all.
Thank you, Michelle. I think what I would say to that is be very careful what you tell your boss. So thank you. I have the good fortune of trying to take over everything, apparently, because not only am I going to facilitate this section, but I'm going to talk a lot as well. So this next section, we're really going to do a deeper dive into the outline that Michelle just presented concerning revisions to the program guidance, and kind of talk about the reasoning behind it. As an adult learner, I know if I understand the reason, I can usually 90% of the time get the thing right. If I don't, and you just give me a series of instructions, I end up building furniture that's not supposed to what it's supposed to look like. But if I have a better idea where we're going to go. So one of the things we're going to do is rather than we will restate some of the things that Michelle said to reemphasize some of the facts of the changes in the guidance, but we're going to step back and say kind of the whys behind it. But during this section, we're going to talk a little bit about the National Performance Measure Framework, the National Survey for Children's Health. Ellen's going to take on children with special health care needs in the family partnership discussion, and then Michelle will wrap up with a deeper dive into the narrative format, the state action plan tables, and reporting forms. So this section now that we're going to talk about concerning the National Performance Measure Framework is also going to include measurement data. And I'm happy to present myself, being Ashley Harai. As you know, we've been living in very interesting times. And Ashley wasn't able to get out on the road yesterday for some very mysterious reasons. Like there was no money to let her travel yesterday in time to be here today. I'm happy to say my colleague, Dr. Harai, is going to be here before the end of the conference and will be a great resource to talk about the federally available data in particular. But a couple days ago, I was sitting in my office going, oh my gosh, I have to present on FAD. And there's Eppies in the room. So what I would say is just be kind to me today. I am representing Ashley. I will gloss heavily on what she would have presented. If you have questions that are going to do a deep dive in questions, you're going to see deer in the headlights here and say, wait till tomorrow, Ashley's coming. Okay. In any case, one of the things that's really important to understand when you were looking at the National Performance Measure Framework is we have to realize that that's only been in place 3 years, and we've taken a very mindful, deliberate approach on its implementation. You know, it took time to get our head around the structure of the framework, where you have strategies, that you have measures that you're going to work that are going to drive change toward your selected national performance measures, with the ultimate goal is impacting the national outcome measures to improve health for moms and kids and families in our nation. What was really important for us as a driving principle as we went through was the fact the journey is still going on around the framework in action. We know for a fact that we haven't evaluated its effectiveness. And so you don't really want to do major shifts on the framework itself as we go forward. We want to kind of keep it intact. But at the same time, we knew when we put it in the field, this theory going into practice, that there were things, unintended consequences that were happening as we were trying to operationalize this with you. What is the evidence? What is a strategy? What is a strategy that you can measure that's going to impact a performance measure? And these questions guided the work group, and there was so much comment from the field as to ways to improve and to share. And so some of those things we're going to talk about. But the key here was we wanted to keep a stable framework. Second thing, too, is reiterating what Michelle said about accountability, flexibility, and burden. We really wanted to continue that accountability around measurement. Measurement was going to be the key, looking at evidence, making sure that that's informing our programming, and yet there was this sense of trying to reduce burden and given that flexibility, keep that in mind. And like Michelle said, we kind of went back to our roots to re-examine the block and just remembered that it's through the needs assessment and the priority needs, as determined by you, that gets addressed in measurement, whether it be by the NPM or an SPM, it's your choice. It's the combination of those in action that allow you to, to put your best story forward with regard to data. Looks familiar? We've seen this. It's the framework in action. It mirrors the evaluation logic model, where we have process and inputs and strategy measures driving national performance measures, or short or medium-term outcomes, heading toward those long-term outcomes or national outcome measures. The framework remains intact. It's there. You have a state choice on measures, just like you had before. The 15 measures themselves are pretty much there. There have been revisions to 2 of the measures with safe sleep and the developmental screening. And Ashley will present that in a minute. And as always, federally available data are pre-populated. Now, we talked about the revisions. Michelle talked on most of these things. There's a minimum of the 5 measures rather than 8 across the 5 domains. But this is also really important, and Michelle touched on it. There's no limit to 8. I know one state came up to me and said, I want 12 of these to work on, because they map what we did in our needs assessment, and they couldn't do that before. If you want 12, you can have 12. Good luck. Because once you enter the National Performance Measure Framework, and this is really key, once you choose those national performance measures, in the National Performance Measure Framework, you are agreeing to develop those strategy measures to drive change toward those performance measures. Remember, your state performance measures are your choice to develop as you see fit. And of course, what we've seen is the evidence-based modeling is taking place with the state measures. But some state measures are much more modest in size Others are more population-based. It is the flexibility and burden to you to decide what that is. So that's why I just say there's an asterisk. You know, there's always a contract when you do something. Anyway, okay, so there we have our 5 population domains. The compound measures, as Michelle said, those that were cross-cutting, that really weren't life course, we saw them hitting a couple of the population domains, but it didn't, how many states came up and said, you know, I want this measure, but I want it for a different population. So it really wasn't a life course in the sense of every single population group were looking at it that way. Those have been split up and sent into the appropriate domains. So where you had pregnant women and smoking, it's now in the women's domain. Where you had those that were children go in the children's domain, and they've been all moved around. And that matrix that Michelle referenced is really great guide as to where they are. So it gives you more choice in each of the domains. That was another issue that so many states brought up. Hey, there's only 2 measures here, none of them really fit. This allows a depth of measure choice. So that's another thing that allows a little bit more flexibility and also to align with what your needs assessment is. And of course, that last systems building domain allows for state performance measures, and there's no national measure. I'm very excited about this because I think this is where new science is going to start to happen. We know for a fact that there is, from the needs assessment and priority needs, sometimes we got workforce development, training needs. We've seen, we want to emphasize health equity. We want to emphasize life course. How do you measure that and what that is? I think the science is yet to be determined. But that said, this is where we can start that experiment. You can start developing state performance measures, thinking through how this would work in order to create measurement and new ideas around it. So I think this is going to be a great area for research to see what you guys come up with. One of the things that's always, what's neat, some people, Michelle, I'm coming after you after outing me about a $1 bottle of water, but Michelle hates checklists. So whenever there's a checklist in a guidance, I'm always fascinated how it got in there. But there are a number of checklists, and this is because I like checklists because it makes me kind of think clearly through it. And this is Ashley got this in, so it wasn't me. Michelle would have said no to me, but she didn't say no to Ashley. But what we have is checklists in the appendix that can help you think through, are you meeting the criteria for the national performance measure? Have you selected 5? There are a number of them that can cross-cut a number of the population domains. Does it match up to your state priorities, which is really key? And is there clear alignment? This was the thing that when Ashley and I were talking the other day, we really want to start emphasizing and making sure, we talk about the ESM checklist, starting to really look at, is it meaningful? Is it driving size? Is it sized right for your burden, for your resources? Is it also impacting the national performance measure? We know that in a discussion at a lot of the block grant reviews, we've seen over and over those moments where a reviewer or a project officer would say, I don't see how that strategy in this measure drives change toward the national performance measure. And I think that's something that we're going to continue to work on. The Evidence-Based Center is going to help us figure out more of the science behind that, and then helping to translate that into real programming is going to be key. So I think this checklist is looking at helping you think through whether it's a good strategy and it's a good measure. It's one of the things that, is it too small? We know how many times you've gotten one part of a process that in and of itself you can't see how it fits into the bigger picture. There's other times when it's too big that you can't see any impact over time. You're never going to see it. So how do you size this against a strategy that's going to make a difference? It will be a continuing point of discussion, reflection, and work between all of us. So, Dr. Harai, Michael, one of your employees, one of your staff is not here. No. So I'm Ashley now. Okay. So magically, no. I mentioned that 2 of the national performance measures were enhanced. They were changed. And this was in a reflection to from input from the field about both of these measures, as well as trying to align with national standards. The national measure for safe sleep, which is coming from PRAMS, has 2 additional indicators in it. It's not just talking about putting infants placed to sleep on their backs, but it's also looking at this, the sleep environment, the safe environment for the infant. The National Developmental Screening Measure changed. It was previously restricted from 10 months through 5 years. And now it's from 9 months to 35 months. And this was done to try to make it in alignment with Bright Futures, Healthy People 2020, and Medicaid, the core quality set of data. These are just slight changes and enhancements to kind of align nationally, as well as to also give better voice to what's happening in the field. There have been some changes to the outcome measures as well. And part of this is based on work that has come from you. It's what the state performance measures have indicated, that we were missing some really key sentinel markers, health indicators, that were not part of our outcome measure cohort. So the additions dealt with teen birth. It's coming from NVSS. We also looked at postpartum depression, foregone health care. In other words, those kids that were unable to attain health insurance. And of course, that's in combination with the underinsured, as well as those kids that are insured. And of course, these have all developed out of state performance measures, as well as strategy measures that you shared over the past few years. And we looked at them and we realized we're missing some really important data that we need to keep an eye on. Remember, the outcome measures are those things that we're going to try to impact with our work around the national performance measures. But there's a really key points of data to keep an eye on, and they tie heavily with the minimum core data set that's being worked on with your EPIs. Again, a couple of the revisions, actually low birth weight and preterm birth, there's been a reduction in the number of measures. That there had been 5.1, 5.2, 5.3, 5.4. Now we just have one measure for low birth. And you look at the stratified data within the measure itself to get more details. That's a way to kind of make it easier to use the data and look at the data. It doesn't take away your data, but it allows you to still access that. But it reduces the overall review of the outcome measures. Some of the work that's happening around the National Survey of Children's Health and the timeline of data for Title V. You'll all remember probably last year in August, we were in block grant reviews, and suddenly there was a release of the preliminary data set for 2016, and then that was finalized in September. Now, the timeline of this release of data annually doesn't fit really well with our submission. So where there's always a lag time in terms of the submitting of the data as part of your application and annual report each July. So this data release is going to be happening in the fall, and by that following spring, it's that data that's going to be pre-populated for those measures. Not ideal. We would love it if it was coming out in March and we could put it right in there to discuss. But what it does do is it allows a really good time by the time the data is released and by the time we use it to take a good look at it. You know, last year, remember, we pre-populated the web reports with the new data, even despite the fact that it was different from the data that had been part of your submission. We thought the timeliness of this new data was really important to get up, but we realized it wasn't exactly in line with what you submitted in the application and annual report. One of the things that's important is Ashley and the team in the Office of Epidemiology and Research collects throughout the year all the data that's going to go from our federal partners as well as Vital Stats that pre-populate the Title V information system for you. And that data has to come in by the time we open the system up for use in April. So again, one of the things that's important is that the TVI's FAD anything coming after April is not going to get into the system for this year's application and annual report. That said, EPIs out there continue to look at data, and any data that you have that's come out, for instance, PRAMS will be coming out in probably in May. you can certainly add into the discussion within the application annual report, even though it's not pre-populated this year. We just don't have the data there yet. One of the things that's important, in 2016, there was an oversampling in the survey, and now that we're going into regular the survey every year, the size is different. And so what you'll see here is the submission year, what's the application annual report year, and what the data that's going to be supporting for the National Survey of Children's Health in the application annual report. You'll start seeing cohorts of 2 years of data going forward at next year. One of the things that's really exciting, and this was one of the things that was a point of discussion since we started that guidance 3 years ago, was this new outcome measure about school readiness. And no one knew what that was. This is really new science in development, and it's all being based out of the National Survey of Children's Health. It's looking at these 5 criteria to do several items that are going to get weighted in certain ways to be able to look at school readiness for kids. Are they ready? It's going to look at their language development, their literacy, cognition, their approaches to learning, physical well-being, and the social-emotional development. This is really exciting. We're working with our federal partners at being able to fine-tune this measure, and Reem Gandor has been such a leader with this in developing this for the future. Again, one of the things that's so exciting about the new data that came out in 2016 is it infused the work at the Bureau in the Office of Epidemiology and Research in being able to then use the data for research articles. And these are the articles that the office has been developed, they're under review, or they're in preparation. And you can see it's a wide range of MCH topics that OER is working on. The other thing, too, is this data is housed at the Data Resource Center, and I had to chuckle at myself when I was walking down the hallway, because right next door, the Data Resource Center is doing a presentation on how to use this system I'm referencing here. So in a certain sense, I got a few screenshots that I'm going to lightly touch upon, but I would say go see Christina Bethel and her team to really get to be able to use the tools that are at your disposal for looking at the data coming out of the National Survey for Children's Health, and also be able to, play around with the tools that allows you to look at the data in a lot of different ways. One of the things you can do is you can look at the block grant measures. You can look at them by every measure that the NSCH has. You can look at it in relation to other states. You're able to also take a look, and you can see a hot spotting table where the results of the survey, are you higher in terms of addressing a measure, or are you still looking and struggling to work on the lower end? So it kind of color codes the entire nation around all the different measures. The other thing, too, is you can look at it from a map display that allows you to see how well you're doing. These are tools sitting there for your use. From the end, if you need the raw data, you can also get that from the DRC as well as the census. Lastly, just a few resources still sitting in the guidance itself. You have, the crosswalk of the national performance outcome measures and linkages. And one of the things I'd like to say that we got a lot of comments about wanting to link a lot more of the performance measures to the outcomes, saying, hey, I see that this has influenced that. It was a very conservative and deliberate approach about the linkages there, things that we could show that they were linked, rather than common sense tells me it's linked. So that was one of the things that we were really conservative on that. They could very well influence more outcome measures with the performance measures, but we didn't overstate. The other thing, too, is we deliberately put in a crosswalk of the national performance measures to the AMCHP's life course indicators. And this was really important because there was a lot of concern that when we got rid of the life course domain, that it meant we didn't like life course. We love life course. But the thing is, what we can see is that you can see how many of these measures really do map across the life cycle and across all of our MCH populations. Again, don't forget, those appendix detail sheets give you all the data about the performance and outcome measures. We've condensed them down to one page so that they don't go on, and so that they're very much more succinct. You can always get the FAD resource document and download that off of HRSA's website, and that gives you all of that data to be able to work with. And don't forget, we also have an archive that TVI State Speak from July 2016 that kind of introduced all of this a couple years ago. It's still a rich, rich resource to use, especially with new staff. If you just need an initial primer, this is a great place to start. Whew. Ashley, thank you very much. Okay. So usually we say we didn't even talk about questions. Because this is all about data, I'm happy to field any questions at this point before we move on to our next speaker, Ashley Harai. No, I mean, Ellen. Does anyone have any questions or any thoughts? Yes.
I have a question about areas that do go across all the domains, like for instance, mental health or behavioral health. So I would, in the past, include that in the life course, section, cross-sections. So where would that be discussed under each domain area at this point? Okay.
That's a great question. Michelle's going to have a definite idea about that. One of the things that I would suggest is I'd say try to keep it clean. What I would say is that cross-cutting section, if you create a measure that, say, hits across all populations dealing with mental health and you have the data and the measure there, I would tie your discussion in that section. That doesn't mean you can't reference parts of it in the other population domains, but it's a deliberate attempt on the state to approach a certain thing in a very holistic way, and that cross-cutting is meant to grab that data and that discussion there. So if you have an oral health approach, mental health, or any of those that you want to go across all, and again, that key would be going across your populations. It's up to you to decide how to do that.
Okay.
Any more questions?
I'm sorry?
The introductory section as well.
Oh, that's a good point, Michelle. Why don't you weigh in?
You're going to hear more about it in a minute, but we have added to the state action plan an introductory section, which also provides you a very nice opportunity to really talk about how your programs are structured. And if you have that cross-cutting, overarching approach, that's a nice place, in addition to what Chris said, to also reflect on some of that.
I think that's a really important point, too, is that new section that Michelle will get into really allows you to discuss the philosophy of your program, of what the Title V and Title V agencies, not only capacity, but its approach. How does it interact with fellow partners? How does it embrace health equity? How does it deal with life course? How does it deal with social determinants of health in terms of informing practice across all your population domains?
Hi, this is Matt Shim from Hawaii. We want to know, and I just want to clarify, as long as we select 5 of the 15 and we touch one in each of the 5 domains, we're able to drop others. And what is our justification for that, if any?
Okay. There's a couple thoughts and questions in there. With this new guidance, this is the new approach. So you are able to make the decisions internally and go down to 5. We heard this is a value coming from especially states with modest budgets, modest federal award as part of from the Title V block grant that just weren't able to do that kind of in-depth work across 8 measures. So going down to 5 is your choice. That said, is that it's a good idea to explain your rationale in the guidance, why you're changing and changing up in the narrative. But it is your choice, and you'll be able to, and EJ is going to show you, talk to how you can go about doing that. This isn't, in a sense, a new day moving with the data we've used. You can keep all 8 and just remap them to the appropriate domains, or you could reduce it to 5 that go across the 5 domains.
One more question?
Yes, one more.
Hi, Brad Planey, Arkansas. Would like to just talk about life course. No, I'm just kidding. I just want to confirm something. In the past, sometimes we had picked an MPM as our SPM. Now that we have unlimited numbers, that we would just move that SPM back as an NPM?
Yes, you could do that. Realizing, Brad, that then you would be following the MPM model with making sure you're going to develop an evidence-based strategy that you're going to measure against the MPM.
So we'd have to take a close look at that.
Right.
Thank you.
That would allow you to have the pre-populated data where the SPM wouldn't have that.
Okay.
So see, there's a perk.
Is that a bottle of water that comes with that?
Yeah. Oh, I always loved you, Brad. With that said, let's move on. I'd like to introduce my colleague and my good friend, Ellen Volpe, who's the branch chief of the Eastern Branch in the Division of State and Community Health. And she'll be leading us through a discussion on the children with special health care needs and the family partnership changes in the guidance. Ellen?
How do I follow that? Am I good on the sound? Okay. I want to start by sharing just a brief personal story. I have a 26-year-old daughter named Renee who was diagnosed with Crohn's disease at the age of 13. And seemingly overnight, she transitioned from being a typically developing child to being a child with special needs. And for those of you who are familiar, Crohn's, like many autoimmune diseases, has a broad spectrum of severity. And Renee was one who happened to fall on the higher level of severity and complexity. And so for her and for our family, the last 13 years has been somewhat of a roller coaster ride of inexplicable and unpredictable flares, followed by wonderful periods of remission. And as those of you in the audience, and I'm sure there are quite a number who have a child with special needs will understand, we of course cherish each and every day of remission. And I like to share that story, never for sympathy, because in fact, Renee has fully embraced her uniqueness. And like each one of us here, who all have our own challenges, her unique circumstances really have shaped her and made her into a beautiful and compassionate young woman. But I share that story because my experiences with Renee have given me a very personal appreciation as well as a professional appreciation for the amazing work that you do, this group right here, to assure a strong system of care for the MCH population overall, but in particular for those children with special needs. And as well, Renee's experience has given me a very personal appreciation of the significance and the value and the importance of family partnership. As good as all of your work is, we recognized on our end that there was room for us in the block grant guidance, as we did this recent round of revisions, to improve the guidance on how you tell your story about CSHCN and about family partnership. So with that lens, as we undertook this recent round of revisions, we looked really critically at how we could guide you. You are the experts. You know your state much better than we do. How you could improve and strengthen your state's story as reflected in the application annual report, which you all know gets posted publicly and looked at by many, many people. How you could strengthen that story about Title V's role in assuring that there is a strong system of care for CSHCN. And at this point, I do have to acknowledge, Michelle introduced me as co-chair of the CSHCN work group. Joan Scott and Marie Mann, who are here with us, clearly did the heavy lifting on that. I was the liaison to our division, but their expertise was really critical in shaping this work, and I just want to acknowledge and thank them for helping us to address this part of the guidance. So first I want to review very briefly what has not changed. Certainly the block grant revisions continue to reflect a continued commitment to improving the healthcare system for children with special healthcare needs. That has not changed. And you all know the purpose of the block grant, which has been there for many, many years. One of those purposes specifically calls out children with special healthcare needs as the third legislatively defined MCH population domain. There also has been no change in the requirement that 30% of your federal Title V funds must be used for CSHCN. And lastly, I want to make the point, we at the federal level continue to refer to it as CSHCN, not CYSHCN, although many of you use that. And that's very intentional on our part because it comes from the statute. So we are being true to the statute, even though we understand and fully support you embracing naming it the way best reflects your work. So the commitment to CSHCN in the statute and at our program level continues to be clear and strong. Also, what has not changed, the Title V vision, the Title V mission, continues to reflect the Bureau's foundational philosophy, which undergirds the block grant, including its special focus on CSHCN. And I won't read this, but you can see that. There's a call out to this population in both our vision and our mission. So what's different? At a very high level, this version of the block grant guidance does not reflect major transformation, as we did 3 years ago, but does reflect a clarification of expectations and what I like to call significant enhancements to how you will tell your story. And designed, again, to strengthen your reporting in a couple of the ways mentioned here, providing, when you think of the overarching description of your application, where you are setting the stage for the work of Title V, providing that high-level framework that describes your state's healthcare system, and identifying and defining broadly the components of your state system of services for CSHCN. This can be a description of what does CSHCN look like in your state? What is the infrastructure in your state to support this population? What's the financing look like in your state? Some of you already are doing this very well, and if you're in that group, keep doing it. Some of you, this is an area where, with our guidance needing clarification, in some cases, this part of your story has not been reflected as strongly as we would like to see it. For this particular population group, we really want these revisions to assure that there is an adequate focus throughout the application on this population so that the reader who is trying to understand what's going on with these funds does not lose that piece of your work. At the wrong button. And so as you are using the block grant application annual report to tell your Title V story, we also want you to be cognizant of and note changes in your Title V's capacity for serving CSHCN and changes in your system of care for serving CSHCN. And what is the impact of these changes on your service delivery? Also critical to telling your Title V story for CSHCN is to be sure to clearly describe the types of services provided by Title V. Are you doing direct, enabling, population-based, all of the above, some of the above? This is part of helping people understand the role of Title V, what difference you're making. Reflect on the impact of those services and think about how you can describe that in a way that someone not as familiar with your work can understand the difference you are making. Describe the role of Title V in terms of what you are doing. Are you serving as the leader? Are you serving as the convener? Are you a funder? What is it that Title V does in that work? The revisions also give you more flexibility related to selecting the national performance measure for the CSHCN domain. And you continue, of course, to have the option of using National Performance Measure 11 and 12, Medical Home and Transition. In fact, now you can select these two measures for the child domain or the adolescent domain as well as CSHCN. But if you do that, you still must address these two measures in your CSHCN domain. That, again, goes back to these being really foundational to your CSHCN system of care. But you also have the option now of selecting NPM 15 around adequate insurance for CSHCN or child or adolescent. And in this case, if you choose to select it for child or adolescent, you are not required to address it in the CSHCN domain. You still can, but you don't have to. And of course, you always have the option of developing your own state performance measures. So if you would like to address other areas that are not covered by these measures, those can be added by putting one or more state performance measures in this domain. We also realized after implementing the 2015 revisions that for some states, there was confusion about what should be reported in the CSHCN population domain. We really want to assure that your block grant application annual report comprehensively describes the Title V role. You all are the steward of your system of care for CSHCN. We want that to come through. We want to be sure that's there. Again, some of you have continued to do it. Some states interpreted our guidance, understandably, as we went back and looked at wanting you to focus in with a laser focus just on the NPM. We really want you to be comprehensive in this story. And so this is some of what we've tried to clarify around the expectations for the annual report, where we talk now about include some language that looks at and provides analysis that will give context to what's going on with your CSHCN system. Include comprehensive reporting on your program activities. Again, leadership partnership, we've talked about this. Be sure that that your narrative in the annual report is fully capturing, again, the significance and impact of the work that you have done in the year that you're reporting on. And then when you get to the application year narrative, similarly, think about being comprehensive in helping someone understand what is it that Title V plans to do over the next 12 months around activities, objectives, measures, but the full scope. And this does not have to be detailed. What we are looking for is for you to capture in a comprehensive way and help someone understand there is really significant work going on, being done by you and your staff. In a similar way, the block grant revisions clarify the expectations regarding family partnership. Family partnership historically has been important in the block grant. The block grant has been a leader in recognizing, acknowledging, and promoting the importance of family partnership. This has not changed, but we recognize that and we recognize also that building capacity of families as partners is a critical strategy for addressing your MCH priorities. But we heard from you, and this was feedback that you provided to us, that the prior guidance didn't adequately communicate the importance of family partnership. And what is not on this slide, Nora wouldn't let me change it yesterday, is the fact that family partnership is now highlighted in the guidance as one of 3 guiding principles for your work in the block grant, along with public health service systems and the performance measure framework. That is so significant, and I hope you all have read and understood and just reflected on the significance of that as one of our 3 guiding principles. In addition, we have emphasis that has not been there before on the importance of family partnership across all MCH population domains. Again, with an emphasis on states demonstrating the value of family partnerships in improving your outcomes for all domains. Again, a really significant change that I want, as you think about next year's application, I really want you to reflect on how you incorporate that. Because block grant, you know, there's never right or wrong answers. It's your story. You have to decide how you can best communicate that story so others understand how important this is. The revised guidance also highlights and encourages states to take advantage of family partnership resources that have been developed by AMCHP and by Family Voices. And that includes the National Consensus Standards for CSHCN, as well as other reports and resources developed by both AMCHP and Family Voices. And on a very practical level, the revised guidance moves the family partnership section so it is now discussed as part of your state action plan narrative overview. So this is after you've described your state, and now you're getting into what is the big picture role of Title V in your state, and then what are all the pieces administratively that are part of that. And this is where, as you have in the past, you'll talk about how you engage families, what the roles are of your family partners, and again, the impact and value of family partners. The emphasis again on discussing family partners across all domains. Again here, no right or wrong answers. If you decide that in that overview, you can fully reflect how families are engaged in all your domains. We're not asking you to cut and paste and repeat that 5 more times across each domain. But where you have something that's unique to a particular domain, that's what you want to highlight in that domain as an additional part of your family partnership work. We have an additional resource that was mentioned before, but I don't want you to miss it. Appendix D now includes a family partnership continuum pulled from an article published in 2013 in Health Affairs. And I want to end by noting that we know that our work on family partnership isn't done. We continue to covet your feedback and input on how well we've done with this version of the guidance and how we can continue to assure that both of these components, CSHCN and family partnership, are reflected in your application annual report in a way that appropriately and accurately captures their importance. And with that, I will turn it over to Michelle. Oh, I'm sorry. We're doing questions now, so let me see if anyone has questions on, yes.
Question, when you talked about
I'm going to wait, I'm going to have you hold until we get the mic to you.
Just to clarify, in the guidance itself, there's a section on healthcare delivery system where we talk about the healthcare delivery system in our particular state. But you've talked specifically under the CYHCN domain. I'm thinking that the place where I talk about the overview of the state and the healthcare delivery system, I am mindful to talking about children with special healthcare needs and that delivery system as well, with potentially some clarification within the CYHCN domain. I'm just worried about space.
Sure. It's a great question, and again, I will give an answer and see whether anyone else wants to add. As with many parts of your guidance, you are going to have to make the decision, but philosophically, we are looking at your state overview is your big picture of what is the environment of my state that someone needs to understand before I start talking then about what is the role of Title V. So depending on if there are pieces of your system that are broader than Title V that that should be described before you then get into Title V role, that could be in the state overview. It may be that you decide it fits best all in one place, and that's okay. You want to think about what will best convey your story. You don't need to feel like, I already said it here, but they're asking me to say it here, so I'm going to just repeat the same thing. That's not what we're looking for. So think about the flow that works best for you. And it may be you put it in the State Action Plan overview, and you don't need to repeat it in your population domain. That's okay, too.
Thank you.
Okay. Did I get that right? Okay, thank you very much.
Sharon, your question was perfect for this. It was a perfect segue to what I'm getting ready to talk about. I didn't actually plant that, and then Nora's going to help me on this section, but this is really more the narrative reporting. I think this slide violates everything you've ever heard about making a slide. I'd like to do a word count, but that's okay. Anyway, bear with me. But, you know, the updates that we've made really were intended to refine the reporting structure, the transformative vision that was rolled out 3 years ago. You all embraced the transformation so well. Over the 3 years, we've really come a long way. We do not want to change any of that. But there were things that, as with anything, they're always evolutionary. We felt like, we could, make it a little better, refine it. So that's really what the changes, and I welcome your feedback to let us know how we're doing. You're going to have to live with it for 3 years, but still, those 3 years go pretty quickly. At the same time, we need to continue to assure accountability as well as state flexibility. And a lot of what we have done with this guidance is really intended to allow the state greater flexibility. So for the narrative reporting, we've tried to simplify it, streamline it. We're going to talk about that on the next slide, which is about as long as this slide. We're going to talk about a more logical flow between sections. You've heard Ellen talking about that. Less duplication. You don't need to cut and paste and put it in the same, in every section. To try to approach it from the perspective, it's one document. It's not this section, that section, that section. It's one document. Clear descriptions. We've heard from you over the 3 years. What do you want? Particularly the executive summary, so we'll talk about that a little bit. So we've tried to really focus on what is it we want and try to make that a little clearer, refine instructions, like I said, for we spent some time actually looking at those reporting forms and trying to tweak them a little bit, not the form, but the instructions. More logical placement of the financial narrative, which we're going to talk about, and clearly defined logic model. I want you to look at that logic model that is in your packet, and it's about the longest, most detailed logic model that you will ever see, but there's a lot of thought that went into that, and we've really tried to outline the process going from your needs assessment all the way through to your interim years and then back to your needs assessment. Continued emphasis on evidence-based and/or informed strategies and measures. And again, this is about the third time I've said it. Look at that glossary. We really spent some time in there, but I do think it helps to clarify. Talking specifically, when you look at the components of your application annual report, it goes from executive summary to the state overview to your needs assessment, either summary or update. depending on whether it's a needs assessment year or an interim year. Then it goes into your state action plan, and then ultimately you end up with public input and or you have financial narrative now before your state action plan, and then public input and technical assistance. Most notable, though, I think among the changes were the updates to the state action plan narrative, the restructuring of it to achieve a better, more logical flow, but particularly to allow state greater flexibility in being able to describe your Title V program. We have heard from you over the past 3 years, and I think it's a point well taken. We don't feel like we can describe our program. You've kind of put us in these boxes, and we're answering the boxes, but when's our chance to really tell you how our program is structured? We use life course, we use cross-cutting. There's nowhere to do that. So you now have a section to do that. You have an introductory section, it's a new section. This is your section. This is your big picture overview of your Title V program. This is telling the reader what they need to know to be able to understand the specific activities that you're going to be talking about in those domain sections. So this is all the overarching strategies. This is your framework. This is your time to talk about your program. Tell us everything you want us to know about your Title V program. And it may be, and we hope, that when you actually get in the individual domains, some of them may actually be shorter because you've already had the chance to lay the groundwork, so you don't need to keep repeating it section after section. So make use of that introductory section. Narrative reporting. We want you, again, the more holistic approach. The state overview. That's introducing the reader to your state. That's state. That's not just Title V, that's your state. So you lay the groundwork, you introduce the reader to your state. Then you go to your needs assessment. And we have collapsed a lot of those sections that you saw previously, whatever they were, C, D, and E, where you had your priority needs and then you linked them to your measures, and that's all collapsed into the needs assessment section. It's part of the needs assessment. You may not have too much to add to that right now this year because you already talked about it in 2015. Keep that in mind for when you report on your 2020 needs assessment. I do want to just take 1 second to talk about needs assessment. That is a critical part of your Title V block grant. Everything you do builds on that. And it's not once every 5 years we do needs assessment. You do it every year. So you have your needs assessment summary on your needs assessment year. The 4 interim years, you have an update you need to provide every single year. We know it's a little confusing in the print version because you still have the original summary. And we're working with our reviewers to say, no, they can't change it, so you don't need to comment on it. You might want to read it, but you don't need to comment on it. The same is true for the previous 2-year update. That's education on our part. The only part you're going to deal with this year on needs assessment is a needs assessment update. But it should be thoughtful. It should talk about your process. It should talk about your findings. It should talk about emerging needs. And that's all part of your needs assessment. And then you go from that. We've moved financial reporting, which we're going to talk about in a minute, but we've moved that up. That used to be kind of stuck at the back. It didn't get much attention, frankly. Some of you had maybe 2 sentences. We need to talk. We need to have a good financial narrative. And it came at the end of the review when people were tired. And we heard you loud and clear at the TA meeting. You all need help on the budget and the expenditures. And so we really are trying to strengthen this area. and then the state action plan. So I hope you can see the logical flow here from talking about your state, from doing your needs assessment, then talking about your resources, and then what is your plan. So let's talk about what I keep promising I'm going to talk about, and that's the executive summary. I know there are some questions here. I do want to make the point, it's still 5 pages for the narrative. We're going to talk about the new sections in a minute, so we'll get to that. But it's still 5 pages. It's intended to be the highlights, the key descriptors of what you're doing. A lot of people, this may come as a surprise, a lot of people don't read that document from cover to cover. They read, this is what they read. So what is it they need to know about your program? And one thing that we've been doing really the past 3 years, but it was kind of after we did the guidance, but to make you aware, what you write in your executive summary is the narrative portion for your state snapshot. If we get a message from the secretary of the department or from the HRSA administrator, they're going to a state, we send them your state snapshot. People in your state, legislators, that's what they look at. So we will bring in, and EJ will be talking about this, we bring in a lot of the data and the charts and all that. We do that for you. But the narrative portion is what you're writing. What do you want people to know about your state? And we purposely formatted it to try to give something back to you all in the hopes that it's a good program document for you to use. Okay, we added 2 new sections, and these are going to be new sections. These are not what you have to fold into the larger executive summary. These are going to have 2 designated sections. You are getting, and EJ and Nora are going to talk more about that, you're going to get some more characters for that. So that's okay. Probably going to be 6 pages now. One is, and we want you to reflect, how Title V, federal Title V funds complement state funds. States, in many cases, states are putting more investment into their MCH programs. Federal funds complement that. They enable you to do a little more. What is it they're enabling you to do? This is accountability. This is documentation for the value of these federal Title V funds. It's a short section. It doesn't need to be 20 pages long. There are character limits. But really, reflect on that a little bit. And then give us a success story. And the question's going to be, well, what do you want? Do you want a personal story? Do you want a system story? It's your success story. But tell us, people, that kind of stuff resonates with people. It's your choice, but reflect on something that you feel that through your Title V program that you're really proud of. And that's not saying it's the only thing, but something you really want to highlight. We spend a lot of times, and we're not going to really talk about them today. We will have other opportunities for talking about the budget forms, number 2, number 3A, and number 3B. They were enhanced, but what I am going to tell you is, again, forms talk to each other. It's all part of your story. So what I see in those forms should match what I'm reading up here. And, that's been an area we've really tried to focus on over the past couple of years. The financial narrative, new title. We heard from one state that, why do you call it the budget narrative when it's budget and expenditures? Kind of a point well taken, so it's now financial narrative. But it is a discussion of your expenditures and your budget. Again, it follows that needs assessment. What are your resources? Then what's your plan? But it, again, should reflect on, you're now reporting in Forms 3, 3A and 3B. You're reporting federal and non-federal funds separately. It should reflect some of that. What are your federal funds? How are they complementing your non-federal funds. I mean, it could be that you're supporting a lot of direct services through your state fund, but the federal funds enable you to do some of the infrastructure, the population-based pieces that you otherwise maybe could not do. So again, some reflection on that. And when you see the character counts, you're going to realize we want more than 2 sentences. Nora has a wonderful handout in your packets on all the character counts, and Nora and EJ will be talking more about that. But Nora Carswell, as you all know, joined our division, 3 years ago when we were embarking on the transformation, and she has just been such a wonderful addition to our program. She brings the IT expertise and has become quite a program expert in addition. So it's just a pleasure. I know she's been able to come to a few of your block grant reviews, and we've heard back how much you appreciate that. So Nora oversaw the working group that had the state action plan table. I'm going to let you do that, and then we'll do questions, and you'll have a break. So welcome, Nora Carswell.
Thank you, Michelle. I'm happy to say I'm just really one slide, just talking about the state action plan table. So it's going to be pretty brief. This year, the guidance lays out a new format for the state action plan table that gets generated out of TVIS for you once you create all your entries within the system. And it's just been some minor tweaks, and it really will look a lot like we had made some modifications to it last year. We made it legal sized, and really the change this year is just the state outcome measures will now be on the table. And the format that we used last year and that we're continue on with through this guidance, it came based on some samples that we saw from one of the states and just input from the states. So the other big change that will impact a few number of states is that you no longer can upload your own format. You must use the MCHB format. And it was important with the guidance that with the transformation that we give flexibility on the last round, but it did make it difficult for us to do reporting when we would not have that data readily available to us. So it should make things, but any state that is having to make that change, we're available to provide guidance and assistance as you're making the move over to the MCHB format. So I guess at this point, I think we're just taking questions. Is there any questions on this last section, the changes? Okay. All right. Okay, so I think it's time. Oh, we do have a question. All right.
The reporting, if you are dropping a national performance measure, you're going to report out on the previous, and then for the future you drop it?
Actually, if you're dropping a measure, you're not going to be required to do any data reporting on it, but we would ask that you speak to it in your narrative discussion. And when we're going to take a short break here, and when we come back, EJ's really going to show you the how you could go about managing your performance measures and get a look at what TVIS is going to hold for you. Yeah. So any other questions? And there'll be the opportunity to ask questions at the very end also. So if we can take a break, come back at 3:20, and we'll start with EJ and TVIS.